All right, let's try this one more time. Can you hear me now? I do not know if you can hear me because this stream is delayed by about 30 seconds from what I can see. So, all right, it seems as if our sound is good. Okay, so I appreciate you sticking with me through that. Um, sorry about the audio difficulties there. I'm still trying to figure out. I've got this very fancy rig, not really a rig, just some stuff, some microphones and some mixers and things to improve the quality of the sound on the podcast. It's only 10 minutes, which you can subscribe to an Apple Podcasts and Stitcher and Spotify and wherever you get your podcasts. And I've been trying to use it for this as well. And sometimes it works and sometimes I screw it up. So again, I appreciate your sticking with me through that. The news today, let's get to that, is really not good. And I don't know what else to say about it. I'm going to reiterate that I don't want anybody to panic. I don't want to make anybody afraid. I don't want to do that thing where we try to get more clicks by making the news seem worse than it is. We're a nonprofit news outlet. We like to have lots of traffic to our website. We like to get lots of social media engagement because that just means we're reaching more people. But it's not really exactly like more clicks make more money for us. So that's not our intent here. But my intent is to be really honest with you that the numbers and the news today is really not good when it comes to coronavirus in the state of Wisconsin. And it's getting to the point where there's no mitigation in the offing. You know what I mean? This isn't like there's nothing to say like we just got to get through this because there's this other thing that's going to help. There's nothing like that in the future. So I just have to be very honest with you that things are bad right now, and there's nothing that's going to come along and make them better. And in fact, they're going to get worse. So here's what we know. And again, this is not a political thing. This is not to blame anybody in particular. I'm not trying to further the governor's agenda or anything like that. These are the facts. The facts are that today we have the second highest number of new cases that we've ever had in one day. And that is 2,300. Let me get the actual correct number here for you. It's just under 2,400. 2,392. Our highest previously was just over 2,500 about a week ago. We had more tests done today. We had over 13,000 tests today, which in a way that's, you kind of be like, okay, well, that's good. That one of the reasons we have so many more cases today is because we have more tests, which is partly true. But also it's true that the more testing you do, the more accurate a picture you get of the state of things. So to have a large number of tests is great because it gives you a real clear picture of what's really going on. And what's really going on is 18% of those tests came back positive. We have more cases today than we've had every day except September 18th. We had 2,500. This is the 4th day in the past week that's been over 2,000 cases. Every day this week has been over 1,200. Every day but one over the past 3 weeks, we've been more than 10% positive tests. 10% is kind of a marker. What the public health folks will tell you is if you keep your positive test rate below 10%, that means you're kind of mitigating the infection. You're not suppressing it. You're not on the downward curve yet, but to be under 10%, you kind of got the curve flattened at least. Under 500%, under 3%, then you're on the downslope. You're headed towards zero cases. We're not going to get to zero cases until there's a vaccine, but you're headed towards zero cases. You're certainly getting fewer and fewer active cases every day if you're under 5 or 3%, preferably 3. For the past 7 days, on average, we're at 17.3%. 14-day average is 16.4%. That's very bad epidemiologically. Okay. Thank you, Margie, for that. We have today 6 more fatalities, which again, given the increase in cases we've seen this month, I fear that that's going to get worse. I hope it doesn't. But what's notable here is that all 4 out of the 6 fatalities today are from relatively rural counties. Brown County has 1. I guess I'm not, maybe 3. I guess Brown County is probably, it's rural, but it's also got Green Bay, which is the 3rd largest city. So Brown County, you probably wouldn't count that as rural necessarily, but Racine County is another one, also not particularly rural. Waukesha County, Waupaca County, Winnebago County, and Wood County. Point is, not big cities, not Madison or Milwaukee. That's where people are dying now. The other big concern for me right now is hospitalizations. And let me tell you why. We have 528 people currently in the hospital statewide, which doesn't sound like a big number. Up until now, I've always said we keep track of hospitalizations not because we're going to overburden the hospital system in the state. So that was the big concern back in March and April, right? That we'd run out of room in the hospital and then more people would die because they didn't get proper care. And that's why you want to flatten the curve so you get the same number of people who get sick, but they get sick over a longer period of time so that there's always room in the hospital for whoever's sick at that moment. Right? That was kind of the strategy early on. It's not a strategy we should be still employing 6 months in. That was a very short-term strategy, flatten the curve until we can get this thing under control. We didn't do that, get it under control part yet. But still, the point I'm making is that up until now, we've always said we pay attention to hospitalizations so we can kind of track the severity of illness. How many people are really severely ill? Out of the currently active cases, how many are really, really sick? Speaking of, we have over 16,000 currently active cases right now, which is the highest that's ever been, 16,300. That's 900 more than yesterday, which is bad. So to be at 528 people in hospital today is bad because, first of all, it's 181 more than a week ago, which is a 52% increase in the past week of the inpatient hospitalized population. It's still not really at the point of where we're in a crisis of unavailable beds in hospitals statewide. I was just looking there. WHA, the Wisconsin Hospital Association, does have some information sort of by region, and I'm going to call these guys tomorrow and see if I can get a little bit more clarity on what some of these numbers mean, because it's been relatively low. The hospitalizations have been in the 300s. I haven't really dug into it a lot, but I want to find out what some of these numbers mean a little bit more. But from just my looking at it here, most regions are fine. The WHA has the state divided up into these 8 regions. 7 regions. Fox Valley, North Central, Northeast, Northwest, South Central, Southeast, Western. Southeast is where things were bad early on. Southeast is Milwaukee County. Basically Fond du Lac all the way down to Milwaukee County, Racine County, Kenosha County. Problem area right now, though, is Fox Valley, which is does not include Fond du Lac County, but is Winnebago, Outagamie, Shawano, Menominee, Waupaca, Waushara, and Ozaukee, and Green Lake County. Not Ozaukee, I'm sorry. Green Lake County. Does not include Brown County. Okay? Brown County is where the big outbreaks are. Does not include it in what they're calling Fox Valley. Fox Valley right now, the ICU, the intensive care units there are 13 hospitals in this region. Total among those 13 hospitals, The intensive care units are 87% capacity right now. Now, they're not full of COVID patients right now. Okay, there are 104 intensive care unit beds in the Fox Valley region. Of those 104 beds, 11 are currently occupied with COVID patients. 11 people with COVID are in the ICU in the Fox Valley region. A week ago, there were 4. Okay, so that's up from 4. Now there's 11. That's a big increase. That's like almost tripled in a week. There are currently 13 ICU beds available in the entire Fox Valley region. So if that trend continues and they add another 7 in the next week, or if that, if it triples again in the next week, we're going to be out of ICU beds. There's only 1 intermediate care bed available. I'm not sure what that means exactly. There are 25 medical and surgical beds, which means that the medical surgical beds are actually at 95% capacity. They're 95% full right now in the Fox Valley region. And they have 72 out of 231 negative flow isolation beds are available. Those are the rooms that they put people in for isolation when they're infected with an airborne infectious disease. Now, is that going to continue? It's hard to say what's going to happen in the next week. But that's it looks to me, my amateur eyes, that's getting kind of close to uncomfortable in terms of the number of beds available. If the trend continues, right? If there's another 52% increase in total hospitalizations in the next 7 days, the way there has been in the previous 7 days, and there's no reason to think there won't be, just given the number of cases we've seen in the past 3 weeks, keeping in mind that like hospitalization is like a 2-week lag. It's like an echo effect. You get a big jump in cases, 2 weeks later, you get a big jump in hospitalizations. That's what's happened every time. So, that we will definitely keep an eye on Fox Valley. The other regions seem to me to be okay. I'm going to talk to the Professional Hospital Association tomorrow, get some better senses to see if they can calm me down on this Fox Valley thing, and then find out like really how the other region is doing. Okay, so that's hospitalizations. That's not good at all. What else do we have? Let's talk about some more numbers. Total case count today is 108,324 total cases. As I said, 16,300 of those are active. It's 20th day in the past 3 weeks, 20th day out of the past 21 that our positive test rate has been over 10%. I talked about our 7-day averages, I think, and fatalities. We're at 4.86 deaths per day and 5.23 deaths per day over the past 2 weeks, which is, again, not as bad as I feared it would be. And I do fear with this sharp increase in hospitalizations that the next echo effect of that is going to be deaths. And we might be seeing 15 and 20 deaths every day a week or 2 from now. Cross your fingers that doesn't happen. It's entirely possible it won't, because a lot of this surge in new cases has been younger folks who aren't as vulnerable. I will say, however, the last couple of weeks, and just looking specifically at Dane County, which is where we really look at the ages, we've seen almost all the cases 2 weeks ago were in that 10 to 19 and 20 to 24. And actually, if you drill down a little more, 18 to 22, because they're college students. But yesterday and today, we're starting to see it spread out a little bit. We're starting to see more people in the 30s and 40s and 50s. We're still not the most vulnerable, but clearly that rampant infection on the UW campuses is trickling out to the rest of the community again now. And UW is going to open tomorrow, or Saturday, I guess. They're going to start having in-person classes again, starting to do some social events and stuff like that. So that's terrific. Let's talk about some locations. Milwaukee County is the driver today, 316 new cases, 27.4% positive results. A lot of rural counties today with high-ish numbers. Barron County has 12 new cases. Brown County, 189. They were over 300 yesterday. Burnett County has 10. Calumet County has 42. Calumet County, very rural county, has 42 new cases today. Clark County has 12. Dane County was going in the right direction, which is what led UW to decide to open again. And now we had 93 yesterday. Today we're back up to 163 in Dane County. Dodge County, which had 4 deaths yesterday, has 51 new cases today. Door County, where people do mask up for the most part, has 29 new cases today. Dunn County is 23. Eau Claire County is 31. Fond du Lac County is 52. Now, keep in mind, all of these places, with the exception of Barron County, has 8.6% positive tests. They're all over 15, most of them over 20%. Door County is at 65% positive tests for the day. Grant County, where UW Platteville is, 21 new cases today, very rural. Green Lake County up in Fox Valley, 16 new cases. Jackson County is not on this list very often. They have 10 new cases. Juneau County, 17. Kenosha County, 53. They were doing pretty well. It's a bad day for Kenosha County. 53 new cases, 38.7% positive tests. Kewaunee County has 31 cases. La Crosse County has 53. Langlade County has 11 new cases. Manitowoc County, or as they say on CNN, Manitowoc County has 39 new cases. They had a very hard time pronouncing Manitowoc when Joe Biden visited the other day. Marathon County, 42 new cases. Marinette County, 33. Marquette County has 16. Monroe County has 21. Oconto has 36. Like, this is spreading into rural areas. If you think you're immune because you live in the country or in a small town, you are not. Shawano County, 45 new cases today. 95% positive tests. Trempealeau County has 16. Waupaca County, 21. Waushara County, 15. Winnebago County, UW Oshkosh, 180 new cases today. Wood County has 21 new cases. It's just crazy, and it's everywhere across the state. We haven't talked about rate of transmission in a couple of days. I'm going to see if I can pull that up. I completely forgot to. I got so caught up in hospitalizations, I forgot to look at the rate of transmission. Where are we? I'm sorry, I'm not seeing us on here. What am I missing? There we go. It's not as bad. Not bad. Not bad at all, actually. 1.11. I mean, that's bad. Anytime it's over 1, it's bad. But 1.11 is better than it was. It's not second or third highest in the country the way it has been. We're like 10th or 11th highest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13th. We're 13th highest in the country. Washington and Wyoming both have 1.34, which is bonkers. That's crazy. But we're at 1.11, which is not terrible. Not as bad as it was in the 1.2 range not too long ago. Again, that means basically every round of infection will infect 11% more people than the previous one. So 100 people have the disease, they'll pass it on to 111 more people. So now you have 211 people sick, right? Pretty simple. All right, that's basically all the coronavirus news I have. I'm going to scroll through here to see if I have any questions, then we'll talk about a couple of the stories. Yeah. Who's telling you that hospitalizations are actually non-existent? It's not true. I mean, Jennifer says keep being told that the hospitalizations are actually non-existent. This is maybe that just mean that not there very many people are hospitalized, which is kind of true because statewide we still have plenty of capacity. However, regionally we're having trouble there in Fox Valley. Okay, I don't see any actual questions. So if you have any questions, drop them in there. I'll just mention a couple of the stories that are on the website today. We have a story up this morning. Actually, I'm sorry, it was posted yesterday afternoon about a new thing, a new Center for Black Excellence in Culture that's going to be built beginning in 2022. This is a ways off yet, but it's Reverend Alex G. Bought some land several years ago with the intention of building this Black Cultural Center. And it's a place to study Black history, celebrate Black culture, to attract and retain Black talent. It's going to be a community center. It's going to be a museum kind of thing. It's very cool. And Dr. G was kind enough to give us the exclusive on that story. He brought it up specifically first to report that. So take a look at that. Also, we have our Si Se Puede list. Part 4 up today. Part 5 will be tomorrow. We have the 39 most influential Latinos in Wisconsin that have been sort of nominated by the community, that we've kind of judged as doing great things in their own sectors. There's some IT people, there's some lawyers, there's some educators, a wide range of people, political people, elected officials that you may not have heard of, but that you should have heard of. So we're just trying to introduce them to you. So that's what those are, our most influential lists are for. Okay, I think that is all I have for you today, unless there are any other questions. Let me see. Any insight into the Wisconsin Counties Association and the ordinance related to giving more power to county health officers? No, I'm aware that, I'm sorry, I don't know much more about that. I am aware of it. I'm aware that the Counties Association is by and large opposed to statewide health measures, and I think there are some folks here in Dane County who are not very happy about that. I'm not aware of any ordinance giving more power to county health officers. That would have to be a state law of some kind, probably. I'd be interested in more if you have a link about that, Jennifer. I'd appreciate it. That is all I have for you today. I appreciate. They wrote the template. Oh, I see. Thank you, Jennifer. That makes sense. Yeah, Counties Association would have written a draft sample bill to put in the legislature that would give county health officials more authority. I would assume that it would take some authority away from DHS. I would love more information about that if you're able to share more. It's a relatively conservative organization, generally speaking, I think. And to pass a bill like that would require the legislature to meet, which they seem reluctant to do. So we will see what happens. Again, I appreciate your attention. Enjoy the rest of your day. And we will see you again tomorrow.